Currently, reflection journals are very common for the nursing student, especially at the end of their nursing course. And it's very good to understand that how best can you address this question in a way that at least you better show your expertise. I'm your presenter, Kevin Sande. The first element that I need to cover is about summarizing the scenario. Because it's a reflection, it's very important to first identify the scenario that you want to reflect in your reflection journal. And first, you need to briefly describe the key events, the setting, and the people who are involved in that scenario, and this helps to provide a better background for the readers to understand what you want to reflect about. Then after doing that, you need to focus on the most relevant details that will be central to your reflection. In the summary, you have the general idea that you start with it by describing it so that people can understand. But it's good also to now focus on the specific area that you need to do. If it's something to do with nursing, if it's something to do with the setting, where is this event happening? You need to be clear at this point so that people can better understand. After summarizing the scenario, it's good to move to the next stage, which is about reflecting on the scenario. So this is the second stage that you need to be keen about. You have summarized your scenario. So it's good to analyze what happened within the scenario you are discussing it, and why did it happen. After doing that, it will be easier now to consider which actions were being taken and the outcome of the actions that were implemented. Actions now are the strategies that were employed in specific to the issues that were raised within the scenario. After doing that, it's also good to identify any challenges or dilemmas that were faced. And here you need to be specific. Talk about the dilemmas that are specific to nursing. We have ethical dilemmas. So by implementing some strategies, they have impact on the dilemmas that nurses faces, which are ethical. So you need to bring out clearly if there were any ethical dilemma that was faced during that scenario. After doing that, it's good now to move to you discuss what you have learned from that experience. So under reflection, make sure that you bring those issues clearly so that the reader can have a better understanding. The third important factor to consider here is on inclusion of feelings and personal reaction to the scenario that we are talking about. Here, you need to describe your emotional response during and after the event. So the actions that are being taken during the event, it's better you show your personal emotions. How did you react about it? How was your feeling? So here you need to be clear. Next, it's important to explain how these feelings influenced your actions or decisions. Remember, in the past we have talked about the interventions that were being taken under these scenarios. So those interventions, you need to talk here, how are they influenced with your feeling? So it needs to be clear. The next is good to reflect on how your emotions might have affected the situations or outcome. So in the previous point, we have explained how the feelings affected your actions, what you did. Then now the outcome that happened, were they influenced by any emotions or feeling? You need to be clear under this factor. The next point is about the case study and real life experience. Now, after you have showed your emotion to the case study, it's important now to provide evidence that will help to support your argument when writing this journal reflection work. So at first, you need to relate the scenario to a similar experience you have had or observed in your real life. So here you need to provide an example in your life that is specific to the scenario that you're trying to discuss so that it can help the readers or observers to have a better understanding. In terms of the case study, it's good to identify areas that have case study established. It can be government websites, it can be databases that have case studies that are similar or they are related to the case study that you are talking about. So when you are getting a study from the databases, it's good to cite them. So you need to cite so that you avoid the issue of plagiarism, and it helps to act as a evidence to whatever you're trying to discuss. After that, it's good to compare and contrast the two situations, the case study that you're talking about or the real life experience you're trying to explain with the scenario that you described, so that it shows the reader or somebody who is marking your work that whatever you're trying to provide as an example is directly related to the case study that you are talking about or to the scenario you are explaining in your discussion. After doing that, it's very good now to discuss how the previous experience informed your understanding or action in the current scenario. So if you had an experience in real life, you have explained it here, then now you need to show people that it's because of that experience that helped you to have a proper understanding of the situation you're explaining. The next part is about use of evidence and citation. When making arguments, when writing reflection journal, it's important to provide evidence, and if the evidence is coming from other people work that were published, it's very good to cite them so that you avoid the issue of plagiarism. Support your reflection with relevant nursing theories or models. We have nursing theories and models that maybe when we are discussing about ethical dilemmas and we have maybe some issue about the nursing theories, please, it's very important to explain which nursing theory or which model did you use when writing this reflection model. We have some people who use Gibbs reflection model, so you'll find that the structure of the discussion follows Gibbs requirement and principles. Then two, it's good also to cite current research or best practice guideline related to the situation. Don't use research that were done in the past, because we normally say that the current research provide findings that can be replicated when such a experiment is done. But when you use old research, it can bring old theories that are not applicable in the current situation. So selecting current research is very necessary. Then it's also good to reference professional standard or ethical principles that apply to this case scenario that you are trying to say. It's also good now to analyze your actions and decision making, because you started by explaining the scenario, explaining the action that you are taking, explaining the outcome, showing how your feelings and emotion influenced your action and influenced the outcome that happened. You have provided the evidence, you have linked the case studies and your life experience to the scenario they are talking about. Now it's very good now to analyze the actions that you've taken. So first you have to evaluate the effectiveness of your choice actions, and the effectiveness of your actions will depend on the outcomes, because now you implemented these strategies and this is the outcome that happened. So can you evaluate and say if the outcome or the strategy that you implemented were effective? If the outcomes are negative, it means that now the action that you took or the strategies that you implemented were not effective. Then two, it's good to consider alternative approaches you could have taken. So the strategies that you implemented, you have evaluated them. Then it's also good now to say we have other alternative options that can be implemented, and these are the predicted outcome. And lastly, it's good to reflect on how your knowledge and skills influence your decision. So here you need now to reflect to prove that it, because of the knowledge that you had or the skills that influenced the effectiveness of the strategies that you implemented. The next part is about identifying areas for improvement. It's good to recognize any gaps in your knowledge or skills based on the scenario that you have explained. After doing that, it's also advisable that you have to propose specific steps for personal and professional development based on the experience you have learned from the scenario that you have explained, the case study that you researched about, and the life experience that you have. Are there specific steps that will help you for personal growth and professional development? You need to state them clearly. Then next, you have to set goals for future practices based on this reflection. Lastly, under conclusion, it's good to conclude with the key takeaways by summarizing the main insights gained from the reflection. Under this section, please just reinstate what you have covered earlier. Don't bring new insights or new points under conclusion. It's also good to explain how this experience will inform your future nursing practices. This part has already been covered earlier, so we are just reinstating it. And lastly, it's good to emphasize the value of reflection practice in nursing.